Hi everyone, I'm Suman Jha, founder of Jilo Health. We are a Patna-based health tech startup incubated in IIT Patna. So, I was listening to a couple of startups and realized most of them are focusing on real estate's big boys game. But when we talk about healthcare, especially for the bottom 90% of Indians, I think we have this 10% of Indians who can afford healthcare, what is available right now. For bottom 40%, government is doing a lot by making this world biggest healthcare schemes, Ayushman Bharat. But when we talk about the India's missing middle, I think neither they can afford the healthcare what is out there, or nor they have support from governments. And looking at that problem, since I come from Patna, and when I faced that problem, it was all about making it affordable at cost. And after trying multiple models, experimenting many, many times, we finally realized that AI would be the path to solve it. To give you an example, again, when we say AI, again, we all say AI, but for the consumer that we are solving, that AI will not be on the front. It will sit in the back, and most of the work will be done by frontline health workers. So when we say affordability part, it is the entire drive that is making us do this. For example, let's say uh, India built this something called ASA, world biggest volunteer-based health delivery program, which is responsible for 65% of healthcare delivery in rural areas. How do you use AI, align with their resources, and make population scale impact? Uh, Now, to sort of make it a lot more impactful, uh, in India, 150 million Indians are pre-diabetic. And of course, this problem is getting larger and larger. Around 100 million people face some form of heart problems, and around 120 million people have BP. So when you have this larger scale population, how do you solve it? So we also understand this since this consumer is also trust driven. They first try with affordable cost and then open their money. And to solve all this, first we build the AI aligned with humans, like the frontline health workers, so that we can do this affordable screening at population scale. What model we have built is essentially takes demographic details, primary vitals, subjective questions. These are done by frontline health workers trained, and it instantly give the risk of sugar, BP, and heart. And I mean, say risk not diagnostic. We don't go into that part, and therefore we come into the class B. That is a lot more riskier, lot less riskier to do that. When we do it, how do we sort of make sure that everyone can afford it? So what we essentially did, even after building all these AI models, what we did, we essentially converted that into this very affordable Jilo Health card. So it's 199 per family per year. So we do monthly screening for them. We do all free online consultations. And what we have done on top of that one is that we have connected our partnerships. So all full stack solution could be used to these individuals. Just to give you a sense, how do we make money? We believe that these consumers will pay you, but they must trust you. And trust comes out when you over deliver by promising less. That is what we have achieved it. And we also believe that once you have this data layer, you can essentially make a lot more money from the people who are making money in the healthcare. That includes hospitals, that includes insurance companies, and they're quite open to do that. So again, I would be very disheartened if I build for a couple of millions of Indians. At Jilo Health, our aspiration is to build for 400, 500 million Indians that come from India's missing middle. And it will require an ecosystem approach, and that is what we're trying to do. We are building this from Patna, and would love to sort of get all the supports from everyone who are aspired to create larger impact for the Indians. So, yeah.
Very good. And I'm very impressed that your model has evolved from last when we spoke.
Yes. So that is what it's like. So we all
Because
established.
earlier I was not clear, but today there is clarity, there is, there's a lot of clarity and solution.
Yes.
Yes.
So this comes out when we are working from in Patna. So we go out every single, let's say when we code in the first half. Second half we go in, let's say, Gandhi Maidan, and technically do these screenings. Me sitting there with, along with front-end workers like paramedics, something. And then try to understand every data point that we can make change so they affordable, suitable, they trust us. Let me give you one example. So we all understand that WhatsApp is the medium to reach out to them. So one of the mistakes we made is that we, after the first screening free, we send out a report. It's instant report, go to WhatsApp. The second time, we shared our website link. And we realized we made the biggest mistake because they believe that if you click on the link, it's essentially going to fraud. So the kind of nuances that comes out is like, we have to understand it to
Yes.
build that at that scale. And the
Yes.
final thing that I would like to highlight is almost we have studied every health tech startup in India, especially building in telemedicine, etc., etc. None of them has achieved any significant impact that we all thought of. One of the reason is because healthcare cannot be 100% digital. It has to be physical, which means there has to be some human in loop. We cannot bring doctor because that's expensive. So we have to use or build AI in a way that a frontline healthcare worker in ASA can essentially do these basics work, and the rest of everything can be built on top of that one. And that would be the largest scale we are talking about.
No, brilliant, Suman.
Thank you so much.
जिलो हेल्थ ने तो बहुत अच्छा ये बहुत अच्छा अपडेट है.
Thank you.
All the very best. Yeah, now
Thank you.
I am really thinking good.
I hope so. We get
Yes,
connected. Thank you
yes,
so much.
yes.
Thank you.